All right, let's talk about the nerves and arteries of the upper extremity, starting with the brachial plexus. So the brachial plexus is composed of nerve roots C5 to T1. Those will then form trunks, the superior, middle, and inferior. These will then divide, with the lateral and medial being more anterior, and the posterior obviously being more posterior, with these cords, lateral, posterior, medial, all in relation to the axillary artery. These will then divide into 5 main branches: musculocutaneous, axial, radial, median, and ulnar. A couple of the big branches to note are the medial brachial cutaneous and medial antebrachial cutaneous nerves, which come off of the medial nerve, the medial pectoral nerve, which also comes off the medial nerve, lower subscap, upper subscap, and thoracodorsal, which come from the posterior nerve, which makes sense, so they're going to go more posterior. The lateral pectoral, which will come down and hit the pectoral muscle. Suprascapular nerve, which is going to come right across and innervate your supraspinous and infraspinatus muscle. And then the dorsal scapular, which will then innervate the quadratus. I don't think it's a quadratus. I'll have to look that one up. As well, we have long thoracic from C5, C6, and C7. And the nerve I was thinking of for dorsal scapular was the rhomboids. I'm not sure why I blanked on that. But continuing on, let's go ahead and talk about the anterior and posterior branches, which it also helps because this is the anterior and posterior views that I've drawn. So from the anterior view, we have the musculocutaneous, which is going to be more in the anterior aspect of the arm. The median nerve, which is going to come more on the lateral and medial and anterior. And then the ulnar nerve, which will come back and pass just posterior to the lateral epicondyle, and then come out right here. I tried to illustrate that. And then the posterior has the axillary nerve, which is going to innervate the deltoid, and the radial nerve, which is going to come down and, like the name implies, is going to radiate, start in the back of the arm and then radiate around. As well, it should be known that the axillary nerve comes out of the axilla, which is where the name comes from. So some review before we talk about the primary arterial scheme of the upper extremity. You have your aorta right here, with the right coronary and left coronary arteries coming off immediately. The ascending aorta will then break apart into 3 primary branches, for lack of a better term. You'll have the left subclavian for the left side of the body, and that will just continue onto the side in the mirror aspect. And the left common carotid artery will ascend up this way on the left side. The right side is different though. So the right is going to have the brachiocephalic come off, which will then after that branch bifurcate into the right common carotid artery and the right subclavian artery. So from here, we've shown the subclavian artery. It'll immediately break down into the internal thoracic, which will go immediately interior to the thoracic cage and continue on down into the abdomen. You'll have the vertebral artery, which will go through the transverse foramen for each of the cervical vertebra. That's C6 to C1 going up. The thyrocervical trunk, which will supply the muscles of the cervical region as well as the thyroid region, but it will also provide the suprascapular artery, which will come all the way across. So even though it is more medial than the next one, which is the dorsal scapular, it will go all the way over and shoot more laterally and then go down along more of the midline aspect of the scapula. And then, like I just said, the dorsal scapular is going to come off almost immediately and head straight down. So after the subclavian artery, we have the axillary artery. And the axillary artery is going to have 3 different sections, each with 1, 2, and 3 branches. So the first part is going to have the superior thoracic branch. The second part is going to have the lateral thoracic branch right here. And as well, it's also going to have the thoracoacromial. So that's going to be the pectoral, the deltoid, the acromial, and the clavicular branches respectively. Each of those goes to a muscle or a bone. So there's 2 muscles and 2 bones there. Here's the lateral thoracic artery. And third, is going to have three parts. So it's going to have the subscapular and the anterior and posterior circumflex humeral. And the subscapular is going to have circumflex scapular, and thoracoacromial arteries. This is going to then continue on into the brachial artery, and that's going to be the rest of the story. That'll do it.